Hello, this is Dr. Jerry Cuomo. I'm here with a rib bond case. We have teeth numbers 8 and 9, which were labially bonded with labial composite veneers. We've got to do a little repair on number 8, but main thing is we're going to be working on the lingual aspect because number 9 has some bone loss to it, and we want to prevent it from being traumatized. So we made some adjustments to her partial that she wears, and by doing that we took a little less pressure, and we put less pressure off of tooth number 9 itself. So right now we're going to go ahead and prep. Excuse me please. Yeah, just excuse me. We're going to prep tooth number 8 and 9 lingual. Basically all we're going to do is just place a small little trough in between, about 2 millimeters in diameter. I'm going to use a 330 burr. We're going to put it right in the contact area, right above, so it goes in there without, just leave it in there nice inconspicuously. No need to numb her unless she feels like she needs it. So similar to orthodontics, and we're going to select the same shade. Go about 4 millimeters width on each tooth, so you get figure about 8 millimeters in length. And go ahead and rinse that thoroughly. I'm going to take a periodontal probe and I'm going to just measure that across. This one is segmented, so we're right about 5 millimeters, so we're going to go a little bit longer. The piece that I already cut out is measuring about 5, 6, 7, 8, almost 9 millimeters, so go a little further than that. And then, like I said, we're going to fill in the inner prox a little bit up in here. Use the same color as we used in the past. I'll try to increase the magnification. We are prepping right into dentin. So I'm going to turn my water spray on. And we'll measure across again. That's about 6. I'll go a little further. Now I'm going to clean in between her teeth. I'll use a fine diamond for that. And then we'll follow that with a scaler. I said before, we have this little area on number 8 also. I'll have to clean that. And now a scaler. And I'm just hand scaling. And we'll just go ahead and dry that off. clean off some of that stain that she might have on the facial surface. And we'll do a good job of rinsing that again. Looks like it's a little bit more. All right. Some more on the lingual. Okay, we'll rinse the lingual thoroughly and then dry. And we're going to use some phosphoric acid. I'm going to need a micro brush, and we'll use that as well. I'm going to go ahead and use a cotton roll. And some more of that syringe again. One more cotton roll. And we'll take the syringe again. Also going to use silane. Let's cover that again. Now this case has been working. I think we're on either 2 or 3 years with the veneers and composite. We went from, I believe, the second bicuspid. So you got 4, 5, 6. These two are ponics, or denture ponics. We changed the color of these two, 8, 9, 11, and 12. I believe we ended at 12. We're ready to rinse that thoroughly. And we'll just remove the cotton rolls. We'll put in 2 new cotton rolls. And we'll lower our light. Everything from here out is so photosensitive. So again, we're going to go ahead with okay. We're going to go ahead with our silane. And apply that. And that's just going to take care of that composite, getting it bonded. That's our bonding enhancer for composite. I also use it with porcelain. And let it dry. I usually go about a minute or so and let it dry, air dry. Now, so now we're going to add our bonding agent. And this is from 3M, Universal Bond. just keep covering. Put it everywhere you want to bond. Okay. Thin it down. I think it's important to thin it down. We don't need it too much of a thickness. I like to get it all thinned down. Now the question is, do you want to bond it first and get that all sealed? Now I've got to mesh it together, so I'm going to bond it, but I'm going to bond it with everything else put in there. So I'm going to lower my light, which is my microscope light. Now I'm going to measure the length again. I'm going to copy the length onto my rib bond. So we're about almost 7 millimeters. So I'm going to remeasure my rib bond material and measure about 7 millimeters off of that. So this is a little too long. So we're going to take off about 2 to 3 millimeters. So I'm going to take my shears and we'll just cut off about that much. Remeasure it. That's about 7 right there. 7 millimeters. Recheck it in the mouth. Actually, that was about, that's about 7, so we're about 6, so I'm going to take another millimeter off. Okay. I got a good clean cut on that. We'll measure it again. That's right. Okay, we're going to put that in our unfilled resin and let it soak in there until we're ready to use it. Okay, now we're ready to put in our composite. So we're going to put a small layer in first, right in the middle, and then we'll embed our body. So this is really a simple, quick, and easy procedure, such low maintenance and such high value for the patient. So I'm going to push this so it's on the end. I'm going to take it and we'll have it right in here. There we go. And just push that in place. Now we're not going to worry about any of this fill in yet. We just want to get it bonded in there. So I need just a little bit more material. Pick it up off the pad. Okay, so we're going to take just a small amount of that and we'll cut that in like 1/3 of that. That's all I need. And the object is to embed it, so you don't want to put too much composite down first. You want to just, that's about all you need. Now, you pick up, that's the tricky part. So we want to get this transferred. You can see it's got a lot of material. Alright, so I'm going to take it, I'm going to wipe it. Okay. I use an Explorer. can just literally just pick it up with an explorer like that. Okay, bring it over. And the whole idea is to push it in place. And then go ahead and tuck it in there. So that's gonna act as the framework. You want to condense that in place so you get all the ends inside of that condensed. So we'll use a condenser.